Good afternoon and welcome to a very special interview show of the Prode. Today it's my pleasure to have Dr. Angelique Coetzee ma'am on the show. Dr. Coetzee is the chairperson of the South African Medical Association and she is the one who discovered the Omicron variant of the coronavirus. Thank you so much, doctor, for taking out the time and a very warm welcome to the Prode.
Thank you so much, and thank you for asking us. And I hope I can add a bit of value.
Okay, so I would like to start by asking that, there is a lot of debates around the Omicron variant of the virus. So can you please explain what actually is this variant and how it is different from the Delta variant of the coronavirus for our viewers?
Thank you. Very good question. This variant is different from the rest of the other variants, and I think the best one to compare it with is Delta, because we all know that Delta, the severity of the disease of Delta and how many people died from Delta and how serious it was, especially in community level as well. So what we know about the current Omicron is that it is highly transmissible. It's most probably more than Delta, but as the infections progress, we will be able to say later on, yes, it was more or not. But for now, it's definitely on par. It's not on par. It's not less than Delta. So we know it's got a higher rate of reinfection following prior infections. We know that its severity relative to prior vaccine variants seems a bit less. And why do we say that? Because we've got fewer hospital admissions, and we've also have a lower proportion of high care and ICU admissions if we compare it to the previous waves. In addition, what do we also know? We know that the vaccination remains effective in protecting against severe COVID-19. We know that, and consequent hospital admission and the score at this stage, the importance of getting vaccinated and boosters as soon as they are available. And we know it's early, yet it's still not early, but for us, it's already 4 weeks into this variant. And we also think it's important that the average person in the public out there knows what would be the symptoms and be mindful so that when they get the symptoms, get tested, go and see their healthcare practitioners so that they can make sure that they are okay. Remember, we say it's a severe disease, but if you get your headache or your body aches and pain, it might be still for you severe in how you experience it. So we need to make sure that you are okay.
Okay, so there's a lot of fear about this variant, especially in India and in Indian media. It's all over the place, and the Indian media is creating the hype that this is the most dangerous virus till date. So, what are your views on it? Do you think that this kind of hype is relevant or not?
So, all viruses are you always need to make sure that you don't underestimate any of these viruses. So if we say predominantly mild, especially in the community, it doesn't mean that the people must say, no, it's mild, I'm not going to see the doctor, I'm not going to get vaccinated. It's still a dangerous variant. But if we compare what we are clinically experiencing with Delta versus Omicron, then Omicron at this stage seems to be on the clinical picture, especially in the communities, milder and not as deadly. I'm not talking about hospital where unvaccinated people mostly are being admitted. And we don't have that high number of patients admitted for COVID-19 specifically in our ICU and high care. People are admitted at hospital for other reasons as well. And those stats, if they are then tested, would be thrown as well into the pot. And then you would see, like, I think yesterday we had 500 cases, 500 plus cases that had been admitted. But again, as I have said, those cases would most probably half of them would be not more than half would be more incidental, not really the patients themselves. That has been there for solely COVID.
Okay, so as of now, we have seen vaccines like Pfizer, Johnson and Johnson, Sputnik, Moderna, etc. So, do you think that that the vaccine developed till date are effective against the Omicron variant?
I think going forward, the development of these vaccines will get better in better protection. For now, the vaccines. Well, in South Africa, we always said that we want you to be vaccinated to prevent you from severe disease. We never said that you're not going to get mild disease. We always were honest and say it will prevent you, depending on which one you're taking, about 94%. We know that Johnson & Johnson is less at this stage for Omicron, and as well as the mild disease also much less than what we have seen with Delta. But still, if we look at the hospital admissions, it's still true to their word. We still don't see the majority vaccinated people admitted. It's unvaccinated people.
Yeah. So there is a lot of debates going around the booster dose. So how effective do you think that booster dose is against the Omicron variant?
It's difficult to say. In the lab with the scientists where they test in the labs, they would find maybe a different picture. The proof always lies in what is happening in the real world. So if you in the real world get your booster, you still have get mild disease. Clinical symptoms may be improving within 3 to 4 days. Then we will be happy. However, if in the lab the scientist says, now it protects you more than 70% against mild disease, and we see actually everyone gets sick in practice, then we know as well there's a problem. So for now, what we are seeing is the boosters should actually protect again. However, how well against a mild disease, we don't know. Because especially in South Africa, we have not started with the boosters from Pfizer yet. It will only be in next year, January.
Yeah. So what are exactly the symptoms of the Omicron variant? Are there any specific symptoms by which we can determine that this person is suffering from this disease which is caused by this variant of the virus?
Yeah, it's very much a clinical diagnosis that you can make. It is the symptoms of the patient. It is the not very sick patient sitting in front of you, but might have a severe headache, a severe body pain, as well as a bit of fatigue, and they might have this type of scratchy throat, and as well as a similar type of cough. They won't have high temperatures. They won't have accelerated pulse rate. They won't have loss of smell. So the patient is not clinically that sick. I'm not saying if they experience their body aches and pain and headache, that's not severe for them. It is. I have seen patients, terrible to see how painful they are regarding the symptoms in their muscles and the headache. But most of them, as we have said, if you treat them with low dosage of cortisone and ibuprofen with paracetamol, for those who can tolerate and take it, they improve within about 5 to maximum 7 days. I didn't really saw anyone severely ill after 7 days.
Oh, okay. So how dangerous is this variant for the kids, kids above 10 years of age?
We see quite a lot of children as well. That's positive, not only me, my colleagues as well. And yes, there was a sort of an increase in the hospital admissions, but again, it was most of those children was not admitted for COVID. They were admitted for something else and then tested positive. I know from one girl, 15 years of age, who had severe COVID, and she died of it. But whether it was Omicron or Delta, we don't know, because our labs don't distinguish in the hospital between who's lying there, is it COVID or, between the COVID patients, whether it's Omicron or Delta, which make the data a bit difficult to answer some of these questions.
Okay, so I would like to conclude by asking that what are some of the urgent steps needed in order to stop the spread of the variant of COVID, of this variant of COVID-19 across the globe? Like what are your suggestions for all the governments of the world, be it South African government or the Indian government or the UK?
So there's two answers. The first answer is the government's got a responsibility to make sure that there is enough vaccines. The government must make sure that there's access to these vaccines. Must make sure that people who cannot afford masks, a clean mask, that they help out there. Must assure that there's running water in, we say you need to hand wash, but if there's no running water or no toilets, you cannot expect people to keep healthy. So you need to look at the basics, and then as well, if look at curfews maybe, and big gatherings. And so that's from the government side. So, but each and every citizen, the people of every country, has got also a responsibility. Their responsibility is make use of the vaccines that's out there. Adhere to the lockdown restrictions, whether it's curfews, whether it's banning of big gatherings, and wear your masks and wear it correctly. So it's not only the government, it's the people as well. We've got a 50-50 partnership here. If you don't do your 50%, you cannot expect your government of the day to do all the hard work. You cannot. You have to do your part as well.
Yeah. Okay. Thank you so much, Doctor, for taking out the time and speaking to us. I really appreciate your views and thoughts. Thank you.
Thank you so much, Ray. Thanks. Enjoy your day.
Thank you.